22. So we welcome you. We're glad you're here, and we have a fabulous speaker for tonight. And so, NAMI is an organization that fights stigma and raises awareness that brain illnesses are treatable illnesses and recovery often happens. In some instances, like my own mother's, sometimes people suffering from depression or anxiety or a major brain illness like schizophrenia, bipolar disorder, it is not a positive outcome, and that person does not have the strength to stay on this earth and has to end their lives and take their lives. So that is something that I live with as a 30-year-old young woman because my mother took her life for suffering from major depression. So, uh, so I welcome you to our meeting tonight, which is about hope, which is about courage, which is about having faith, and which is about the gift that NAMI brings to everyone, which is fighting stigma, making everyone feel not alone, not isolated. You don't have to carry your grief and your shame in an isolated way because you're surrounded by other people who have similar experiences, similar relatives, and similar struggles. The National Institute of Mental Health says sometimes they say it's 1 in 5 of us has a mental illness. Sometimes they say it's 1 in 4.
Mhm.
So it is our disability rolls throughout America grow and grow and grow because so many people are disabled with a brain illness. So I welcome you, and NAMI has answers. We educate people at a very high level how to cope, how to face these illnesses, how to have knowledge about brain biology, the etiology and causes of the illnesses. We have peer support groups for those people who do have diagnoses such as schizophrenia, bipolar disorder, and we have support groups for family members, all online, all on Zoom. And we have peer support groups. And I want to introduce you Elizabeth Stevens here, who runs all our peer support groups. I want to introduce Tim Davis over here, who is our senior program manager, who takes ending the silence and speaks in high schools, colleges, and junior high schools to open up people's minds. It's okay to talk about a brain illness. And I want to introduce you our illustrious and talented executive director, Erin Raftery. And Erin, I'm going to turn this NAMI Westside LA meeting over to you tonight because you're going to introduce our guest speaker. So welcome all of you. Thank you for joining us tonight. And Erin, I'm turning it over to you.
Thank you, Sharon. You're always a very hard act to follow. So, thank you for that warm, warm welcome to all of our community members and to all of you who might be tuning in afterwards that weren't able to join us live this evening. Um, all of the wonderful classes and support groups and more information about our services I put in the chat. There's links there for our classes, support groups, our Cal Hope project, which is a COVID response grant. So lots of answers for a lot of the questions that we have right now with all the uncertainty in the world. Also, there's a link for membership. It's because of people like yourself that come and support us that we're able to offer these programs. This evening, we have a wonderful guest that was introduced to us by one of our board members, actually Dorit Haroni, who I think she's trying to sign on, but she said you have to meet this woman. She's really amazing, and she has an amazing story of love and loss and hope. And I think she'd really be someone special for our community to meet. So, as a mother, a lawyer, an educator, and now a mental health advocate, her son's death has inspired her to work to improve the system that is failing so many. Increasing awareness of mental health and influencing policy and decision makers to positively affect those suffering has become her mission. Through the creation of the Bradley Sonnenberg Wellness Initiative at USC, sharing her family's story in person or in Zoom presentations like this one, along with the creation of her new podcast entitled Getting Thru, she hopes to educate and erase the stigma surrounding these issues please join me in welcoming Andrea Sonnenberg. Andrea?
Thank you. Thank you for that lovely introduction. And thank you for having me. And most importantly, thank you for the amazing and important work that you guys do as an organization. It's crucial to the health and welfare of our Angelinos. So thank you for that. I'm going to go ahead and get started. So I'm going to share my screen. Okay. Wait a minute. Hold on. Sorry. It's not. There we go. Okay. Okay, so I am going to cover up my screen so you can concentrate on the slides and just hear my voice, and then I'll come back when we have the Q&A at the end. So I'm going to tell you two stories. The first is a tragedy that ends, as most tragedies do, in the death of the protagonist. The second is a story of survival with a hopeful ending, although it will evoke tears, frustration, and disappointment along the way. The tragedy I'm sharing today is the story of my youngest son, Bradley, who died at the age of 21. In 2017, while my husband Glenn and I were celebrating at a holiday party, we got the call that changed our lives forever. Bradley had passed away. It was unfathomable. When a young person dies unexpectedly, most people assume accident, suicide, or drug overdose. In Bradley's case, as in much of his life, the cause was far more complex. In a world where we want answers, there were none. In order to go on, I knew that I desperately needed Bradley's death to have meaning and become a rallying cry for change. So I'm speaking out, telling the story of one young man that is representative of thousands like him. In telling his story, there are lessons to learn about how to recognize, deal with, and find comfort living with mental illness. The story of survival is mine, and it's one peppered with renewal and hope. People talk of the COVID-19 crisis as a pandemic of historic proportions, and it is. But there's another pandemic, one that began a long time ago and likely will be with us for a long time to come. It will not mutate away or be controlled by vaccines. It's the pandemic of mental illness, an ailment that is affecting the entire globe in crisis proportions. 1 in 4 of us struggle with it. Over half of all college students self-report suffering from it. And yet, people still don't talk openly about mental illness. I'm a perfect example. It's taken me 3 years since the loss of my son to find the courage to share our family story. Let me begin by telling you about Bradley. He was quirky, but so beloved by Glenn and me, his big brother Jake, and his twin sister Lauren. He was generally happy, seemingly like other kids, but at times he was difficult to console, so we held him a lot to keep him calm. He often felt uncomfortable in his own skin. At age 2, he had difficulty with sensory input. He often threw tantrums. Sounds and touch were a problem. He cried too tight when we buckled him into his car seat. By age 4, despite the smile on his face, he had trouble making friends and interacting with others. There were signs that things weren't exactly right. During a ski lesson, when all the other kids were paying attention to the teacher, Bradley was unable to focus. A typical problem for young boys, but for us, a foreshadowing of problems ahead. Transitions were hard for him. In fact, everything was hard for him. We had a saying in the family, it's hard to be Bradley. I searched for answers, but it became clear that we needed help. We consulted a therapist who wasn't sure if it was a permanent problem or one that would pass. I chose to believe the latter. Plenty of preschoolers behaved like Bradley. Figuring out whether it's developmentally normal or signaling a larger problem is difficult. Bradley was always tough on himself. Nothing was ever good enough. He was patient and understanding of others, but a perfectionist in his own performance. If something didn't go exactly as planned, he had a hard time adapting. He missed social cues and often just didn't fit in. His kindergarten teacher encouraged me to make play dates for him. When I did, I scheduled them at our home so I could intercede to ensure things went smoothly. If I did have to drop him off, it was so stressful. When he misbehaved, instead of being sympathetic, I was embarrassed. In retrospect, I wish I hadn't made it about me and instead focused on him. There was no reason to be ashamed. We learned that Bradley's differences, his pain and sensitivities, meant he was a deep and caring soul. He noticed beauty in the world, from the tiniest of Earth's creatures to the sound of the rain. He loved comic books, candy, and Disneyland. He was such a character, but there were difficulties. A teacher relayed that one day when Bradley's classmates were goofing around behind her back, they all knew to stop when she turned back around. He was oblivious and kept at it, always the one caught misbehaving. Bradley didn't process things the way other people did. At age 9, the school psychologist thought he had a nonverbal learning disorder and suggested a neuropsychological evaluation. The psychiatrist disagreed, diagnosing him with anxiety and recommended therapy 3 times a week. The doctor's words, "We need to change his personality," were devastating. It didn't make sense. We loved Bradley as he was. We opted for a less intense program, hoping Bradley would outgrow his issues. I still lie awake at night wondering what might have happened if we had taken that advice. Around this time, we steered Bradley towards musical theater. He sang like an angel and took to the stage like a natural. He began to star in musicals, fell in love with reading, learned to play the piano. He seemed at peace and started to shine, getting A's and participating in school activities with other kids. But he really wasn't fine. He started to keep kosher. And since we weren't Orthodox, it didn't make any sense. His lunches started coming home exactly as I had sent them. We came to understand that restricting his diet was his way of controlling his world. During a family trip to Germany, when we went to Subway, Bradley's favorite restaurant, he refused to eat. We thought it was just the food in Europe, but later learned that it was an eating disorder, anorexia, one of the most emotionally devastating illnesses that impacts the entire family. Bradley dug his heels in. He wouldn't leave the hotel room or eat despite our frantic pleading. He begged to go home. It was awful. We worried about Bradley, but also about what this was doing to Jake and Lauren. Glenn wanted to send Bradley back to Los Angeles to be with my parents who felt they could get him to eat. I couldn't imagine sending my young son alone across the Atlantic. Neither option felt good or right. But I made the decision to defer to Glenn and put him on that plane alone. The 4 of us carried on, although we felt broken and incomplete. But as with so many things in life, it wasn't black and white. Part of me was relieved that he was home safe with my parents, and it gave us the chance to spend time with our other children who still really needed us. We had a hunch they might also be suffering. We later learned that the unaffected sibling is an actual condition. Putting a name to our children's feelings of neglect, stigma, and guilt helped us be better parents to them. Shortly after returning home, Bradley stopped eating completely, and his psychiatrist insisted that he be admitted as an inpatient at a renowned eating disorder clinic, where he remained for 7 weeks. It was terrifying to put our 11-year-old son in a psychiatric hospital with mostly older and female patients, but the doctor said he could die otherwise. He was prescribed his first medication for mental illness. We hoped it would help, but it was scary to start him on pills at such a young age. We came to the hospital every day, bringing games to play, and even Coco, whom Bradley adored. But our visits were restricted to the public area. We were not allowed to visit his room or tuck him in at night. And there was abusive behavior that I only know about because I arrived at the hospital at the exact moment it was taking place. Bradley was locked in a small room as punishment, screaming, "Mommy." It was horrible to watch. How could they do this at the place we brought him to for healing? I should have trusted my instincts and barreled right through the door to pull my son out of there. What I didn't understand then was that power imbalance crippled me. When I summoned the courage to ask why this was happening, I was told Bradley was difficult to manage. Maybe the doctors had a treatment plan, but the nurses handling the daily operations were out of line. What other terrible tactics were they using to control our son? It was cruel and unacceptable to treat a child this way, but we were desperate with nowhere else to turn, so we kept him in the program. After Bradley's inpatient stay, he transitioned to a less restrictive and unlocked outpatient program. Every day during break, I would bring him a giant Cinnabon to get him to eat as many calories as possible in one meal, known clinically as condensing. He gained some weight during the hospital stay, which was a small triumph. But a few weeks into the outpatient program, they called to tell me that Bradley was sneaking out every day, and it just wasn't working out. Seemed like they were giving up on him. The first time we felt our mental health care system fail us. A failure the hospital itself seemed to acknowledge by never collecting the balance we owed for services. We didn't tell anyone about Bradley's hospitalization, so he wouldn't be labeled as mentally ill. It didn't seem fair for the diagnosis to follow him for the rest of his life. I was guilty myself of perpetuating the stigma since I wasn't willing to share our story. Suffering in silence exacerbates the pain and sense of isolation. We were so lucky. Bradley had maintained his friendship with his really good friend, Jordan, the one person we told, and he visited regularly. Without this amazing 11-year-old boy who stood by our son, Bradley would have lost all hope. Transitioning back to school for 6th grade after the hospital was difficult. Bradley struggled to regulate his behavior, unable to follow instructions or abide by the rules. There were incidents of dangerous behavior. He was egged on by other boys to climb on the school roof and jump. Because he was so desperate to be included, he didn't see it as bullying, and he dived off. Fortunately, he wasn't hurt. He found liquid mercury online and was mesmerized. Unaware of its dangers, he brought it to school and to his psychiatrist's office. Every time the phone rang, I was terrified. Someone was calling to complain about something outrageous he had done. At that point, his doctors implored us to send him to a therapeutic boarding school. I couldn't bear this, so I called the psychiatrist begging for Bradley to be seen every day so he could continue living at home. I was told his safety couldn't be assured any other way. I desperately sought out a second opinion that would let me keep him home, but no such luck. The school imposed restrictions on Bradley, no recess or lunchtime where he could get into trouble. They weren't equipped to help him, but no one was. There was no place for Bradley, the second example of the system failing our son. Parents worked to have him removed from school so he wouldn't have to be around their children. Instead of coming to us with their concerns, our so-called friends complained to the administration. When a child has a physical illness, everyone bakes cakes and brings casseroles. With mental illness, there's only whispers and silence. I wish people had reached out to check in on me so I wouldn't have felt so alone. Glenn came to the conclusion that Bradley needed to be in a therapeutic living situation before I could bear that. The thought of Bradley living away from his family was unimaginable. I was not ready to say goodbye to my baby boy. But that Christmas, during a family trip, we realized there was no longer a choice. Against our strict instructions, Bradley swam out too far in the ocean and we lost sight of him. Glenn made a mad dash into the water to save our son. And if it weren't for my husband and the paramedics, he would have died that day. We spent the next several days in intensive care, and it became clear that I couldn't keep Bradley safe. So we presented him with the option of a therapeutic boarding school in Colorado. Bradley felt out of control and realized he needed help, so he agreed to spend the next 2 years there. And it gave me peace of mind to know that my son was finally safe and gave Bradley's siblings a more normal life. Often these boarding schools are awful. We were lucky to find one that was palatable to him and saved his life. Using a technique known as a milieu environment with an emphasis on outdoor activities, they resolved his relationship with food, taught him to understand natural consequences, and most importantly, believe in himself and his ability to succeed. We had such happy times at our family visits. It was transformational for Bradley to be in an environment where mental illness was not stigmatized. He excelled in his classes and made friends with similar struggles. He studied for his bar mitzvah, and we took a trip to Israel for the ceremony. When he returned home, he seemed like a completely different kid, happy, loving, and grateful. A year later, he accepted an invitation to participate on a panel of successful alumni at Parent Weekend. We considered this to be a victory. I had a feeling of euphoria because I naively thought he was cured. Glenn had a deeper and more intuitive understanding that Bradley had a chronic condition that would always need managing. I couldn't accept that. Bradley's transition back to life at home went smoothly. For 8th grade, we enrolled him in a school for twice exceptional learners, students with a combination of special abilities and disabilities. For high school, he wanted to try a mainstream school, and we wanted him to have that experience. Frozen. Can you guys hear me?
We can hear you.
Okay, sorry. Sorry, it froze. Hopefully, okay. There we go. At D. Toledo High School, he flourished in every way, hanging out with friends and attending both proms. He starred in all the musicals, playing Seymour in Little Shop of Horrors and Mark in Rent. And he didn't just play a character, he inhabited it, researching and purchasing the perfect prop for each show. An old-fashioned camera for Mark and cockeyed eyeglasses for Seymour. He was considering a career in musical theater. He started taking dance lessons so he could become a triple threat. And he even had headshots taken. Bradley was a libertarian, suspicious of the government and its overreaching control. He used his savings to purchase a Bitcoin long before its exponential rise in value. Our funny, silly, and irreverent Bradley was at his peak. He loved modern art. Rothko was a favorite, and he insisted that it be viewed from the proper distance with hands cupped around the eyes to better live the life of the painting. His love of books continued. Reading was his comfort and his comforts. Once, when reading a Franz Kafka book and asked what he was doing, he replied, "I'm getting my Kafka on." He loved science fiction, dystopian novels, and books with deep philosophical meaning. Bradley and I shared a passion for reading, which led me to start Wise Readers to Leaders, a literacy program for underserved students. Bradley was so proud of this work and actively participated as a volunteer. This photo was sent to me by one of Bradley's friends who still honors his memory by keeping his favorite books on her night table. Photos can tell you a story, but can also be deceiving. They demonstrate how a mental health disorder can often be an invisible illness. Here, Bradley looks like he was doing great, but there were still so many issues. Despite his outward appearance, he was often anxious before going off to meet friends. While he shined in the escape of performance, it was the real world without a script that was daunting. This picture was taken in the middle of class at the end of his junior year when inexplicable pain and fatigue set in. It often was difficult for him to confront the day, to get himself out the door, to make it to class, to raise his hand. His teachers, doctors, and friends didn't believe him, but I knew his pain was real. Together, we sought out specialists, trying to figure out what was wrong, developing a deep emotional connection. We were joined at the hip. We saw therapists, psychiatrists, neurologists, endocrinologists, immunologists, allergists, along with acupuncturists and related Eastern medicine specialists. Although there's evidence that chronic pain is associated with mental disorders and substance abuse, the connection in terms of cause and effect is often unclear. In Bradley's case, the consensus was that he had depression and anxiety. Simple labels, which can be difficult to treat. And Bradley came up with his own diagnosis, chronic fatigue syndrome and fibromyalgia, convinced it was caused by a past viral infection. No doctor ever confirmed this. All the consulting professionals believed it was psychiatric. I later learned there's a name for this, somatic disorder. It's an excessive focus on pain or discomfort, often disproportionate to the symptoms. A person develops pain and then anxiety around it, which then intensifies the pain. When someone falls, an X-ray shows the break and a doctor uses a cast for healing, something concrete we can see and for which we all immediately seek medical care. When someone hits a mental wall and can't get out of bed, it's often hard to know whether it's just a bad day or something that won't resolve on its own and needs professional treatment. And unlike a physical illness, nearly 60% of us don't receive any mental health treatment or counseling. Confirming a diagnosis can take months, even years, and still be elusive. This was a terrible time for Bradley. Despite his difficulties, he kept up his regimen of therapy, mindfulness, and meds. We hoped he would finish high school and were so thrilled when he made it to graduation. And then on to USC to study theater. We were hopeful that his love of performing and this new experience would give him a fresh start. But with his mental health not well controlled, the transition to college was too much, and Bradley dropped out before the end of the first semester. When he left, no one said goodbye, and no one reached out. It was shocking that the university didn't follow up in any way to make sure he was okay. The third example of the system failing our son. After Bradley dropped out of school, it was time to rethink how we define success, acknowledging that it doesn't look the same for everyone. This can be tricky. The person struggling must continue to dream, but with realistic expectations. It was hard for Bradley to accept that things were more difficult for him simply because of the way he was wired. These celebrities underscore how people who are wired differently can still achieve tremendous success. Over the next several years, Bradley became increasingly despondent and detached. One psychiatrist likened him to a porcupine, very hard to get close to because he was so prickly. It was as if he intentionally wanted to repel people. After his unsuccessful attempt at college, he agreed to try several mental health facilities and programs across the country. A neurologist diagnosed him with peripheral neuralgia, a nerve disorder, which could have explained his physical pain. More meds were prescribed with more side effects. Chronic pain is hard to treat, so patients often seek care from multiple doctors. This leads to polypharmacy, the layering on of multiple medications, not always appropriately. Because of the complexity and lack of knowledge of mental illness, physicians often overuse the only tools available to them, medication. As Bradley was now 18, things became even more challenging. When he was a child, we were in charge, but now we had less influence, even though he still needed us. It was difficult to be pushed away. We felt helpless. When Bradley returned to Los Angeles, he moved to a sober living home. He wasn't a traditional addict, but since many addicts suffer with mental issues and mental health patients often turn to drugs to self-medicate, there is a blurring of the lines. They offered services like daily mindfulness and behavioral therapy. It felt like a really safe place for our son. In contrast to inpatient stays, Bradley was more free to come and go, and we visited with him often. Bradley's attempt to self-soothe included an obsessive search for the perfect cocktail of meds. His multiple doctors, who were not talking to each other, agreed to his requests for more drugs, further contributing to the polypharmacy phenomenon. He drank lots of Red Bull, trying to fight his overwhelming fatigue. He found supplements online from questionable sources, including many from Russia that were unregulated and potentially dangerous. Glenn and I intercepted and threw away packages sent to our home, but we couldn't control the things just sent directly to where Bradley was living. Bradley's misguided attempts to save himself were self-destructive. It was shocking to see him so withdrawn and depressed, isolated in a room full of people. It was easier for him to put his head in a book than to interact with others. The pain from mental health issues often leads people to self-medicate in the form of alcohol, illegal drugs, prescription meds, or supplements. It can offer short-term relief, but over time leads to addiction, worsened mood disorders, and increased health problems. Bradley was clearly over-medicated. Why didn't his psychiatrist see that? He eventually agreed to see a new doctor who was going to help him reduce his meds. His life coach encouraged him to take on new activities, a class at community college in which he was excelling, volunteering at a homeless shelter, and trying to engage with others his age. We were optimistic, so proud of how hard he was trying. Sober living homes are not required to be licensed, nor do they have to report deaths. Despite the fact that the majority of their patients take medications, they aren't allowed to dispense them. Rather, they just hand over bottles of pills, like you see them doing here, a recipe for disaster. One night, Bradley complained of not feeling well, was offered his usual cocktail of meds, some Advil, and sent to bed. He grabbed a Red Bull before heading up. No one bothered to check on him. And just like that, Bradley was gone. Yet another patient in a system that is operating with little to no oversight, and one of 67,000 that died from some kind of drug overdose or reaction in 2017, that number jumping to 100,000 in 2021. What happened to my beautiful Bradley? The coroner's report said he died of psychiatric drug interactions. Medication was critical to Bradley's treatment. Every drug found in his system had been prescribed to him. So what went wrong? It's hard to know where to place the blame. Was it the doctors who prescribed too many meds, inadequate oversight, lack of collaboration between doctors, absence of regulations in sober living homes, the interaction of the meds in his body, or his desperate need to self-soothe, which led to his death? One more tragic and avoidable death, and the fourth and final time the mental health care system failed our son. It's easy to write a prescription to treat symptoms, and insurance companies are more likely to pay for meds than therapy. During the COVID pandemic, it's even worse, with an increase in prescription writing by more than 20%. In many cases, meds do work and provide relief. However, they often come with serious side effects, including the risk of people over or undertaking them. And it's important that they are coupled with effective therapy. Bradley had loving parents and siblings with all eyes focused on him. He had access to the best health care available. Not everyone is so lucky. Sorry, it froze again. And despite Bradley's privilege, we still couldn't save him. Bradley had a rich and meaningful life despite his challenges. His struggle was only a part of him. It didn't define him. In the year after we lost Bradley, there were 9 student deaths on campus. So to address this catastrophic problem, to honor the memory of our son, and to be that rallying cry for change that's so important to me, Glenn and I established the Bradley Sonnenberg Wellness Initiative at USC, which offers wellness programming, a mental health curriculum, and private therapy. College students are young enough to benefit from such interventions, and programs like this are already being replicated on college campuses across the country. In trying to accept this horrible loss, I've wondered how our family could have better helped Bradley. Was there anything more we could have done? I often thought if I'd been a better mother, I would have been able to fix my son's problems. This is a common misperception that bad parenting is the reason for a child's abnormal behavior, that with firm discipline or tough love, problems will disappear. As a parent who was also raising 2 mentally healthy children, I thought I knew what was in my control and what wasn't. Turns out I was partially right. Good parenting can help, but sometimes when we think we're being good parents, our behavior is actually serving as a trigger that can make things worse for our child. When Bradley died, it was my children, my sister, and a few of my closest friends who formed a loving cocoon around me, refusing to let me give up. Then our larger community arrived with the proverbial casseroles and cakes. And over time, it was my grief group who saved me, understanding the complexity of loss. Whether you have lost someone or are still in the fight against mental illness, finding a community to talk to is life-changing. We couldn't save Bradley, but I realized that I could help others and raise awareness of this critical issue by sharing his story as I am today. In addition, my podcast, Getting Thru, where I interview young adults with stories of how they get through mental health challenges, is reaching more listeners every day. People are searching for strategies and stories to help them navigate the complex world of mental health. I hope you'll tune in. My message, and that of the Getting Thru podcast, is simple. As long as you or your loved one are still alive, there's hope. In conjunction with the podcast, I'm doing a weekly Instagram live series with people in the mental health community, professionals, gurus, program founders, or just simply someone struggling, sharing a story so others feel less alone. Follow Getting Thru podcast on Instagram and join our community as a listener or even as a guest. And despite the failures we faced in our story, there are reasons to be hopeful in yours. Higher education institutions have added staff and developed new approaches for providing higher quality and quantity of help for issues ranging from life skills to suicide prevention. Telemedicine and app-based services have made mental health services more accessible, including ones that address stress and anxiety in children and teens. And now mental health services are even being offered at CVS. In the Black communities, due to the historical importance of barbers, programs have developed training to become mental health advocates, assisting clients through active listening, positive communication, validation, and stigma reduction, known as psychotherapy. President Biden's proposed budget includes $1 billion in new grants aimed at improving access to school mental health services, including hiring additional counselors, psychologists, and social workers. The increasing use of peer-run centers for mental health treatment operated by those with their own stories of recovery as an alternative to hospitalization and involuntary commitment. They have successfully decreased emergency and crisis services by 70%. Psychedelic drugs are showing great promise. Bradley was a big believer in the potential. Deep brain stimulation and electric shock therapy are more utilized as treatment options. And since the pandemic, the Boys and Girls Club of America has created a new resilience building program that's being offered at its numerous clubs in LA, with the hopes of replication across the country. The healing power of nature is another critical tool. And there's now evidence that surf therapy decreases mental health issues, not just due to the physical activity involved, but the mindfulness that surfing requires. Mental health experts, not police, now serve as first responders for mental health emergencies, offering expertise with suicide attempts, substance abuse, and serious mental illness in several cities. And California moved the needle with its new landmark legislation requiring insurers to cover medically necessary mental health and addiction treatment. This should serve as a national model for reform. There's a movement afoot to improve and standardize addiction programs to be more science-based in the highly unregulated addiction treatment industry. In the California Senate, there is a bill in the works to regulate care at sober living homes. And there's another bill to encourage students in California to receive age-appropriate mental health education. If we can start educating kids from a young age, we can bring these issues out of the shadows. And there are things that we can all do on a personal level to help, starting with a simple telephone call to someone who is struggling. Research shows that just one phone conversation provides a significant mental health impact, offering a major mood boost and completely shifting the course of their thinking. I urge you to stop the stigma, be an advocate, work for access to treatment, and raise money. Change is possible. Change is part of Bradley's legacy. My hope is that you will leave here today with a better understanding of and compassion for mental illness. Bradley has inspired me to join the fight, to turn tragedy into transformation, loss into legacy. I am committed to advocate on behalf of a system that is failing so many. He would have been proud and humbled to know he is serving as a catalyst for change. Thank you. Thank you.
Thank you so much, Andrea. Thank you so much. That was beautifully
Thank you
told.
for sharing your beautiful story.
Yeah,
Oh, thank you. Thank you.
thank you.
Thank you so much.
Thank you. So I am happy to answer any questions with the rest of the NAMI team that's here with us. So if anyone has any questions, love to, oh, thank you. I'm seeing all these nice chats. Thank you. It's my absolute pleasure. So please feel free to reach out. And if you also, and I'm also always available. Erin can share my email address. I'm always available. Feel free to reach out. If you know anyone that might be interested in being on our podcast or being on our Instagram Live, we'd love it. So keep me in mind.
Thank you, Andrea. I just shared in the chat too the Getting Through podcasts. So it's available on Audible. So you can check it out there, and the link is in the chat.
Thank you. It's available anywhere that you get your podcast. Thank you. Thank you. Oh, thank you.
I just want to say thank you. And it's so hard to be a parent when you don't have any support. And I was lucky that when my son was 19 and he had his first psychotic break at UCLA, that one of the social workers gave me a brochure on NAMI, and I had no clue what NAMI was.
Right.
I was familiar with AA and all these other programs, but I didn't know there. And then I took a family to family class, which really helped. I had 27 new family members that were going through aunts and uncles and what I had been going through at the same time. But what I realized, siblings never would visit my son at the hospital. I have, they thought it might be contagious, or
Yeah.
so it was hard. I mean, still to this day, there's not a lot of empathy. People, they share all their successes, but 100% of us are going through something right now. And it's isolation and loneliness, and it's a very tough time. And I commend you. It took you 3 years to really get yourself to really talk about this. And a lot of us have had losses in this, but this is very, very difficult. And what a beautiful soul. I mean, his eyes.
He was a beautiful soul.
Oh, what a stunning, beautiful, beautiful, beautiful.
Thank
young
you.
man.
And what I say is that his work isn't done. And so his work, I am carrying on his work. He was a light and a gift to this world, but he struggled. He was really struggling. And when I got the call, I thought he took his own life. I figured that was what it was. And it was since shown that it wasn't. But who really knows? Who really knows? They didn't find opioids or anything in his system. But we think, and that's what's really scary. And that's why I feel like this message is so important, that, the mixing of all these medicines can be very dangerous. So, it's really important to stay on top of anyone that's taking lots of medications. And that's why, and it's also hard when someone hits age 18 and then doesn't want their parents involved anymore. It's really important to try to get that 18-year-old to sign a waiver, so that you can at least stay involved with respect to medications and treatment plans. Like I would always say to Bradley, I don't need to know your private discussions with your therapist. I don't want, that's all your privacy, all your private information, but I do want to know what medications you're taking and what the treatment plan is. And I think that that's like a reasonable thing for families to be able to ask for when a youngster reaches 18. But it's hard because they become, autonomous because they're 18.
Andrea,
Yeah.
hi.
Oh, hi there.
So when Bradley was in the sober living environment, what was your relationship with the administration and like the staff there, and what were you allowed to know or privileged to know, and how does that work when they're adults?
Again, it's nothing unless you sign, a waiver, unless the 18-year-old signs a waiver that says you can have access to the information. It's all between the adult, the over 18 adult, and the provider. And they don't have a lot of regulations. They're not licensed facilities.
Mhm.
I didn't realize that. And sort of now knowing what I know, you got to be really careful at those kind of places.
So what would be a lesson in terms of when you were talking about how different psychologists, psychotherapists were administering medicine to him, and there wasn't really like a quote unquote quarterback? What's the lesson for all adults who are dealing with this with their children? I mean, like, how do you navigate one person that's in charge of the whole gamut of medicines?
You need to find a quarterback, and you need to say, you're the quarterback.
Mhm.
And it can be the psychiatrist, it can be the neurologist, it can be the general, the general practitioner, if that's who it is, but there needs to be someone, and that person needs to be talking to everybody. So there's no polypharmacy. So there's no, this one's prescribing this and this one's prescribing that. And you don't know, and then they start, they're trying to help themselves. They want to feel
Right.
better. So Bradley would ask this doctor for this and this doctor for that. And,
But how common is it to have a quarterback in this realm compared to like in a regular medical thing when you have like cancer or whatever you're dealing with?
it's very hard. It's
Mhm.
very hard. I mean, if you go to a facility, it's better. I don't mean it's better, but you have more, there's a more likelihood that there's like someone that's in charge.
Like a structure or order in it.
Yeah.
Mhm.
But if you're on your own, it's really hard. And that's why I
Yeah.
say I like a parent to stay involved if they can, even if they're over 18,
Yeah.
and then say if they won't allow a parent, maybe they would allow an aunt or an uncle, or, maybe there's like some adult. I think that even if you're an adult beyond, you're not a child anymore, or even, you're in your 30s, your 40s, your 50s, whatever. It's good to have someone involved with it, with anything, with like,
Yeah,
any,
I mean, it seems funny because when you have elder parents and they ask you to become their, medical wherewithal, like a power of
Yeah, their
attorney,
power of
power of
attorney.
health directives, and you do that for your elder parent, but there's no structure for that for your children, especially in terms of if they're having any kind of mental problems and
Right.
mental difficulties.
Well, you can do like that. You can do a power of attorney for healthcare,
Yeah,
but it really only comes into play when somebody's incapacitated.
right.
So, but you make a really good point. Like we do it for our elderly parents. We should be able to do it. We should be able to do it for our young adult children as
Yeah.
well.
They're struggling so much. Yeah. Well, thank you again for sharing your story. I love you.
I know. Thanks for being there.
Yeah.
Yeah, Andrea, I just have something to say, and thank you for sharing your story. It's just so touching and heartbreaking. I think in that case, as far as having a quarterback, what we've used before And of course, it's if your child will let you, but a case manager, like we hired someone that is a case manager. And I think one time it was a family therapist who agreed to be the case manager and be the quarterback with all the care people on the support team. And then that person, you pay on an hourly basis or whatever to, to keep track of everything. But the whole thing is that the child, in our case and in yours, would have to agree to it. And a lot of times they don't want the parents to have access, even through the case manager. So.
Well, and don't forget, in my situation, my son was living at a sober living home that was advertised to us as having mindfulness and DBT therapy and had a case manager there. He had a life coach, and he went to a daily outpatient program at a mental health facility. So there were a lot of people. He was under a lot of people's care. And there's still like just completely, it just happened.
Yeah.
And
the problem too is we really don't know the trajectory of medications in different people's brains.
Yeah.
Someone could have that polymorphous amount of drugs and they would be fine.
Absolutely. That's what people.
Another brain will not be able to take it. So
and that's
so much we don't know about medication affecting the neurotransmitter flow in brains.
Right. Well, the bottom line, you just hit the nail on the head, is there's so much we don't know about the brain still.
Right.
Of
So
course.
that's why one of the things that's so important and that I hope will come out of the advocacy that I'm doing is we need more research. We need more brain research. Like, how can it be 2022 and we're still using the medication that came out of Prozac and its descendants from 30 years ago? I mean, it's unbelievable. It's unbelievable. So, we need to learn more about the brain. That there is no question about that. And hopefully through organizations like NAMI and advocacy and budget.
And making it much more normative, and making people feel much more comfortable about talking about it and sharing their stories. I think that definitely through COVID, there's been a lot more people, and even in forums that are, I don't want to call them celebrities, but who have a lot of follower base and are sharing their mental illness and mental struggles, that really puts it to become more normative and that you can talk about it.
And I find that the younger generation, as we were mentioning at the beginning of the program, are much more willing to talk about it. They're much more willing to share that they're seeing a therapist or that they're struggling. And I think it will only sort of continue to get better and better as we continue to tell stories and share. I love the program, NAMI's program, ending the stigma program that they do is amazing. That's exactly what we need to do, to let people feel okay, to reach out and increase the work that we're doing in this area so that we can have more medication, we can have more treatment modalities and solve the problem. It has to be addressed the same way that we treat diabetes, and we're doing research and we go on walks. We will have the diabetes walk and the MS walk so let's have the mental health walk. We do have a NAMI walk. We have NAMI walks across the nation. Perfect. That's what we need to do. And that's what we need to support. And, that's what we need to support.
And this whole HIPAA law where when someone is an adult, you cannot talk to their parents or their family members, comes from the prejudice that the medical profession had against families and parents. Parents are part of the problem. Parents were enabling, they were engulfing, and so get rid of the parents and we'll just talk to the client taking the meds. And that's okay with so many psychiatrists because they don't want to be bothered with parents anyway.
Right.
Much easier just to deal with the patient who's 19 and talk to him. So we got to change this whole, people with cancer, people with lupus don't get well without the support of families.
Of course not.
Of course.
Not.
We need supportive families all the way through. So someone's got to change these federal HIPAA laws. Got to.
Yeah, that's exactly right. Do I see a hand? Is that Colette? No. You're on mute if you're trying to talk to us.
Sorry. I just want to thank you. I'm sort of blown away with your presentation. And your strength and the way you can talk. I'm just, oh my God, you have been, my heart goes out to you, and I feel for you because I'm a mother who's going, your son, I have 3 sons, one's well, and the oldest one is schizophrenic in jail. And my youngest, who's a little performer, brilliant little kid, I'm struck because there are similarities with your son, and it terrifies because he's talking about this pain he feels inside. He's very open. You know, we're working together. He's at the therapist with his father, who might walk in. But I just want to thank you because I'm just, with your bravery, I don't know how you seem so stable. And I think, you know, I try to be stable, but you're so strong. And the way you go right to the heart of it with that strength, I appreciate that so much. And one thing I'm so confused about that I would just be wanting to ring. So you have this son who's trying so hard. What I don't understand is, isn't it the psychiatrist, one person who gives the medication? So I'm wondering, like, are you saying your son was like going to doctors and didn't tell you, ordering online? Like, how does something that this, I've never heard of this, Polly, but in other words, do you think that he was listening to friends? Oh, try this for this, or I mean,
He did a lot of research on his own, and he actually was amazing. Like, he would read double-blind studies, and I mean, he was not just in chat rooms. Like, he was really reading studies, and he would convince psychiatrists to prescribe him things. And he had just switched to a new psychiatrist, and she gave him more medicines, and then they wouldn't taper him off of the other medicine that he was already on. So the new psychiatrist would pile on more medicines, and then he was getting these supplements that were coming in. And then he finally agreed that it was out of control, and he would go to this new psychiatrist. I found this amazing psychiatrist, and he didn't believe in as many medications as he was taking. He did a lot of mentalization. This guy was unbelievable. I was so thrilled. And Bradley actually went and met with him and liked him. And then he was taking his college class. And I mean, really, he was like on this trajectory. And I get this call out of nowhere, you know, just completely out of nowhere.
It just doesn't, it's so, I'm so pain. I just can't even imagine, because your son is not, it's like he's taking the steps that he thinks are helping him. So that's what is so.
That's why it's so heartbreaking, right? I mean, he wasn't a drug addict in the traditional sense. I mean, he wasn't, taking heroin or meth or, but in a way he was somewhat of an addict, because he was like taking all these medicines to try to cure himself, and he couldn't figure out how to do it. He couldn't.
What I have the hardest trouble with is, and I have a son who's very articulate and very willing. He's trying to help himself. And he was like this kind of real performer, like looking great on the outside for years. Yeah. Everybody, and I was like, oh yeah, that's my kid. Everything. I mean, my life has been completely, because I had these kids that looked one way, and then this like it's just, I'm spinning trying to understand. But I will say that he's very articulate, and he doesn't know what's happening to him when he talks about this pain. Right. And he's 18 now. He goes, I have this pain. And we took him to a somatic woman, and I keep, I'm just like, he wants the help, but these diagnoses or how to help our loved ones. I'm so grateful he talks with me.
That is the best
thing.
I'm
so grateful.
Yeah,
and
that is the best thing.
It's like, he's going to go to college in acting, and you mentioned, and I'm like, maybe he shouldn't, like, that thing where they take that leap, that as a parent, you want them to take a leap, but when are they ready? And, it's just, it's such a terrifying journey to know the best thing to do. And you did everything. I mean, watching, I see you're a mother that did absolutely everything. And I'm so sorry. I'm so grateful to you for the work you're doing. I just want to say, I'm so grateful to hear your bravery in speaking like this. It really means a lot.
Thank you. Well, feel free to reach out. I'm always happy to offer advice and comfort and support and all that kind of stuff. And my hope is that there will be less situations like mine, and that it won't, and that it won't happen again. And, if I can save or help one person, I've done a service. So,
Andrea, I think you've helped way more than one person. I wanted to ask, very touched and moved by the four failures I think you were pointing out in the healthcare system. The one that really hit me is about the school that just seems to completely let him down, and nobody said goodbye, and there was no follow-up. And I'm curious about your advocacy work with schools, and how that's going. Are you, are
Well,
you having,
it's interesting.
Yeah.
Yeah, because it's interesting because I gave this presentation at USC. And I thought about taking USC out. I thought about not including the name of the university. And then I said, no, I'm not taking it out. And I gave it at USC. And the person on the panel afterwards spoke up and said, we have really changed our policies. And that's awful what happened. And it will not happen again. And we have people that are assigned now that are assigned, each person is assigned someone from the wellness office, and they do follow up with people. So the system has been changed. So I am glad to hear that. But he just slipped through the cracks, and it was awful, just absolutely awful. And
also, there was a guest, one of the guests I heard on your podcast talked about, he went to UPenn, and he talked about the pen face or something.
Yeah.
He's like, you don't show anybody how you're feeling, and that's a point of pride.
Yeah.
So I'm just wondering if you're feeling like that kind of, really harmful mentality is being pierced a little bit.
I absolutely think it is being pierced. I absolutely think so. From the comments that I get from people, from the discussions that I'm having with people, especially since COVID, I'm not sure. I really think it took COVID to pierce that.
I do too. Yeah,
definitely.
I really do. People realize this, like I say, this is a pandemic without a vaccine. We have two pandemics going on. One has a vaccine and one doesn't. And I think that people have realized, and young people in particular, that we got to talk about it. And we got to let people know what's going on. And I'm not going to pretend, and I say, I have this thing, you ask someone how they are and they say, oh, I'm fine. And I say that FINE stands for feelings inside not expressed. So, don't just say you're fine. And if you don't want to hear how someone is, then don't ask them. Because if you are asking someone, then you should expect to have an honest answer, and we should expect to be there for each other. And I feel like, because now sometimes how are you has become just part of hello. Hi, how are you? It's just part of hello. And we really need to be there. And like I said, one phone call can make a difference. One phone call can save a life. It's just really important that we be there for our loved ones, and be there for people, and be there, not even necessarily our loved ones, be there, be kind to people, be kind to the person at the grocery store. You don't know what they're going through.
Andrea, you've interviewed a lot of people now in your podcast, especially a lot of young people that have been on the front line struggling. What has been your biggest takeaway? What have you seen that's been a parallel, or something that you've seen kind of aligned with a lot of them?
Well, one thing is that they're much more comfortable talking about their struggles.
Yeah.
You think our generation would have identified themselves by name, on a podcast, on the airwaves,
right,
in the ether? No way. So they're way more comfortable talking about what they're going through and what they're experiencing. They really want to connect. They want to be live a meaningful life in the present. They want to be mindful. They want to, they want a proper balance between social media and, I spoke to a young woman today who's a therapist actually, and she actually sets a timer on her phone. I didn't know you could do this, for when she's on social media too long, and it shuts off the social media. So she goes, well, there's ways around it. So I can still do it if I really wanted to. But, I think things like that, the fact that they're conscious of that and cognizant of the harm that too much social media can do, I think is really great. And it's something, and it's a takeaway that I've gathered from them. they want to be connected, and they want to feel a part of something, and they want to feel like their life is meaningful. And so most of these people, in fact, almost all of them that I've dealt with, almost all of them, in fact, I'm trying to think if there is even one that isn't, are in professions where they're helping people now, and really want a meaningful existence. Where,
Beautiful.
doing, what is it? Doing good and doing well.
Mhm.
And yeah, they're all, I'm trying to think if there's anyone, they're all studying to be therapists, teachers, life coaches,
That's great.
one's developing an app for mental health, so I would say those were my takeaways. And they're really inspirational. Like, they really inspire me, and it gives me hope in this next generation. And these are young people that have had really severe struggles, and they're able to get through, and they're able to be an example for other people. So it's incredible.
And one
Wow.
common thread I heard is that they all pointed to the day they learned to ask for help as like they finally, and that was the turnaround.
Yeah.
And when we talk to kids in school, that's what we're trying to encourage. Like, it is okay. It's better than okay. It's necessary to ask.
It's necessary, right? I think that's exactly right. I think that's
And
exactly right.
I loved hearing that echo in the interviews I listened to. Like, that's such an important message for everyone to hear. But
Yeah, and then one thing I did learn, which we all know, but I actually heard it firsthand, was some difficulties in some of the minority backgrounds. So in terms of extra stigma, where in the Latinx community, this poor young woman, her parents were like, "Why would you want to talk to a stranger about your problems? You have your whole family here," and she's like, and this poor young woman is cutting and, severely depressed, tried to take her own life several times, and, had to really like beg her family to let her seek help outside of the family. Same thing in the Black community, same thing, and, he tells me, the young man that I interviewed says, they said, just be tough. Come on, just tough it out, bro. There's nothing wrong with you. You're just too sensitive.
be a man.
So, we really need to be supportive in those minority communities, and get the message into those communities is really important, because we're working extra hard because they've got, like they feel the stigma more than in some of the more communities where there's less stigma, basically in the white communities.
Yeah.
Anybody else have some questions?
I just wanted to say, Andrea, my son at one point stopped eating. He was 5 months at UCLA, paranoid schizophrenia. And I remember when you said your parents tried to feed your son when he stopped eating. Well, my dad's girlfriend made this, I'll never forget. She brings a corned beef sandwich with coleslaw she had microwaved with mustard. That must have been sitting in the car, brings it to my son to eat. And he looks at her like, and he was on IVs. But as a parent, what we go through, I don't know how parents sleep when their children are at the hospital. I've had many sleepless nights worrying and anxiety. And you know what it is? It's being a caretaker. I've been studying, my dad's 89, and and what you said something at the beginning, this is a pandemic of mental illness. And I went to visit my 89-year-old dad today, and I really thought he was deeply depressed because he doesn't get out, and he just didn't have this zest, of life in him. And I just felt so, I said, I'm taking you on a road trip. We're getting out of here. But there's so many, it is related to it all relates to elderly as well.
I was going to say, it's not just young. Exactly. My mom struggles as well. So it's aging is hard. I know.
Yeah.
And
a lot of the gerontology population does suffer from depression, literally, because they have less to look forward to. They know that their life is short and they can't make plans like younger people do. I'm going here, I'm going to see dad in Boston next year. They can't make these kind of plans that younger people can make. So they really suffer from depression because life is so short when you're older.
Yeah, well, and you can't do things, you can't
Yeah.
move the way you used to move, and you
Yes.
can't hear the way you used to hear. And I'm watching it with my own parents. Yes, yes,
I
it's
had a brilliant therapist say to me, I am a therapist myself, say to me, all of aging is about loss.
mm-hmm.
Well, you're either going to be the first or the last. And if you're the last,
Yeah.
you're to suffer from a lot of loss.
That's right.
Yeah,
That's
it's
right.
tough.
That's right.
Yeah.
Well, Andrea, thank you for having the courage and the faith in us to tell your story. And thank you for being you and carrying on your son's legacy and
Yep.
teaching all of us. You're such a gift to the community.
Aw,
May
thank
your
you.
story change somehow some of the aspects of the mental health system. May
Thank
it.
you. Thank you.
Thank
Thank
you
you.
so
thank
much.
you. It's my
I
pleasure.
just
And
have a last question, if I may. How are your other children doing with the loss, and how's the last few years has impacted them?
it's very hard for them. Very hard. My daughter was his twin. So
There was a twin. I'm sorry, I missed the very
no,
first.
that's okay. So she lost her twin brother. So that was quite traumatic. But I'm proud to say, and not proud, I'm happy to say that they're okay. They're okay. It's a loss, and we all have a hole in our heart. And we will never be the same. More so I think as a parent than as a sibling. But they're okay. They're both excelling in their work that they're doing. And we do every year at Christmas time, we do a book because Bradley was such a big reader, and we pick a book, and it's part of we call it Bradley's library. And we pick a book that's something that he loved, or something that in a genre that he would love. And we send it to all of our friends, and they each send it to their friends, and they write a letter about their brother. And so they do that every year. And I know that that's something that's really important to them. And so like we just did it, and now we're starting to talk about what's the book going to be next year. And they send it all across the country to their friends that live all over, the place. And so, they do a lot to honor their brother and keep his memory alive. But it's really hard, and they'll always, like I said, they'll
Do they
always.
go see therapy? Are they in therapy?
They're
Good.
both in therapy, and they both went to grief group. They went to support groups right when it happened. And they're both in therapy. And my daughter laughs. This is funny. She's this shows you how much more the younger generation is about therapy than we are in our generation. She said, I don't think I could date someone that wasn't in therapy. So,
I'm only saying that because my husband lost a brother. He was very young too, but he never saw a therapist. He's 54, 55 now, and it has impacted his life. He's gone severely. That's why I say, they're in therapy, because when things don't get resolved as they get older, people, because to have a loss to that extent,
Absolutely.
Mhm.
No, they went to group therapy, grief therapy, and then they both saw therapists, and they're both still in therapy. And
Good. Because it's a big hole in their heart, and it's, it
we
will
were
never get resolved, but if they have a safe place, so when, as they get older, your sadness, and if you haven't talked about it, it becomes for my husband, has become a mental thing, because, he has severe anxiety and depression because of, his
Right.
past that he never took care of,
Yes, you can't, you have to deal with the loss. You definitely have to deal with your feelings and accept it and learn to live with it, but to do it, live with it in a way that you can still feel good about it. And we talk about Bradley all the time, and we honor him, and, he's still a part of our life, but not on this planet, so thank you.
For being brave and sharing your story to so many people. You've made, I'm sure that, I'm touched. Thank you for sharing.
Thank you.
Thank you for your work.
Welcome. Thank
Thanks,
you.
Andrea.
Thank you.
My pleasure, everyone. Keep up the good work, Nami. I'm so impressed with all that you do.
Thank you, Janice, for this great series.
And you know what? I just wanted to say, Allison, my children lost their dad. My youngest son was 15, and that was truly a trigger
Yeah.
I believe that the schizophrenia was hereditary from my dad's family. I blame it on my dad. It's your fault. But, but it was the trigger of losing his dad. And I see a lot of time, my older son suffers from, he never really talks to people about what he's going. It's very hard. And
Yeah.
we, as the parents, take the grunt of them not talking about, or the wives or the whatevers.
Yeah.
It's very hard. And Andrea, my biggest thing right now is self-care, and I hope you take time out for yourself.
I do. I really, you can ask Allison. I do, right, Allison? I do.
No,
Be
Andrea's doing an
COVID safe.
amazing job of healing through story and healing through sharing Bradley's journey. So I'm so proud of you, honey.
Oh, thank you.
My new thing tonight, fine. I'm fine. Feelings
Me too.
inside, not expressed.
Isn't
Yeah,
that
I love that.
I
That's
know.
a new,
So
that's
great.
going in my book of inspirations by Andrea. That's a good
Love
quote.
it. Thank
Yeah.
you.
Thank you. Andrea's quote.
So I want to thank you, Janice Black Warner. We have this Janice Black Warner Speaker Series because of Janice.
That's
She
right.
has
Fabulous.
donated so much money to NAMI Westside Los Angeles and is one of our major supporters. And everyone in NAMI loves Janice Black Warner. So I want to take
Well-
this moment as we end this meeting with Andrea to thank you, Janice, for all of your gifts to NAMI. Thank you from the bottom of my heart.
Oh,
And
that's
our whole board.
And many will see this, Andrea. It will be on our website, and many, many, many people will share it. Before the pandemic, we used to have 70 people coming to each meeting. We had it at Vista Del Mar.
oh,
But
wow.
I think, yeah, that's where we started because we didn't have a home for NAMI. And I'm on the board. I said, Sharon, so I asked the board if we could use the boardroom, once a month on a Wednesday night for a couple hours, and they let us because we could park there and meet in one place. And then it evolved into this, and just recently, it's different topics. People
Right.
come when they're more they'll be able to see this because, as I said, a lot of people have stigma and they don't want to be on things, but they go independently and watch them. And
That's
Yeah.
great. That's
thank
great.
you, Andrea.
I
All right.
just
My
wanna-
pleasure.
Thank you all. Have a good night. Thank you so
Right.
much.
Thank you,
Just
everyone.
wanna
Take
Announce
care.
our speaker
Talk
for
to you
in February. We're having Dr. Melody Anderson speak on addiction and mental illness and this dual diagnosis and treatment modalities for addiction and what happens to family members when they have a relative with an addiction and a diagnosable mental illness. So Dr. Melody Anderson will be our speaker the first Wednesday in March. Thank you again.